All right, let's dive right into today's explainer. We're exploring a fascinating and honestly inevitable intersection that's going to affect every single one of us at some point. We are talking about bridging the gap between the raw biological realities of our aging bodies and the actual physical environments of our most personal spaces. Specifically, we're going to break down exactly how we can adapt our homes to support daily face care and personal grooming as we get older.
So, Section 1, the realities of biological aging.
Let's completely rethink how we define age. You know that number on your ID card? Well, it might actually be lying to you. There can be a massive, massive gap between your chronological age, the years you've been alive, and your actual biological age. Depending on your genetics, your lifestyle, and your environment, that gap can literally be up to 20 years. You could be 80 on paper, but biologically functioning like you're 60. Or, unfortunately, vice versa. But what exactly is driving this biological clock, especially when it comes to the changes we see staring back at us in the mirror?
It really all boils down to one thing: vascular aging. This is the biological process where our blood vessels, specifically those tiny, delicate capillaries, just start to lose their function. Now, this decline obviously impacts our internal organs, but it also directly dictates the health, the elasticity, and the overall appearance of our skin. So, when you look in the mirror and notice the visible signs of aging on your face, you aren't just seeing old skin. You're essentially looking at a direct reflection of your vascular health.
And of course, accompanying those internal vascular changes are some very real, very physical hurdles. As we age, we naturally lose muscle mass. Our tissues and joints, they lose that youthful flexibility. The simple everyday ability to reach up high, bend down low, or even just rotate your torso becomes incredibly restricted. Plus, our nervous system reaction times just start to slow down. Think about your normal morning routine. Suddenly, reaching for a towel, leaning over the sink to wash your face, or twisting to grab a bar of soap, it transforms from an automatic habit into a difficult, painful, and frankly dangerous task.
Moving on to Section 2, vision loss and light. Okay, a healthy young eye has this brilliantly clear lens that processes light sharply. But as the years go by, the lens of the eye naturally thickens, hardens, and literally turns a yellow or brownish color. This isn't an anomaly. It's a biological reality for most elderly folks. Imagine walking around your own house wearing amber-tinted sunglasses 24/7. That is exactly what it's like.
Because of this yellowing effect, the entire way we perceive color changes. Pale blues, they just wash out into muddy grays. Subtle color contrasts completely fade away, and depth perception gets totally blurred. To safely navigate a bathroom and to actually see any contrast in the mirror while you're trying to wash up or shave, an aging eye desperately needs bright, high-contrast, glare-free lighting. We're talking about needing a highly specific illumination level, exactly 300 to 500 lux, just to comfortably handle personal care without straining your eyes.
Which brings us to Section 3, independence and life satisfaction. So what does this all mean for someone's mental health? Well, losing these physical and visual abilities directly threatens a person's core independence. When an elderly person can't safely use their own bathroom or manage their own basic hygiene, they're suddenly forced to rely on others for the most private tasks. And the research is crystal clear on this. Losing that autonomy leads directly to social isolation, profound emotional loneliness, and a severely, severely reduced sense of life satisfaction. It is a massive psychological toll.
Let's look at the solutions in Section 4, ergonomic bathroom design.
How do we actually fix these spaces? It all starts with the exact measurements. For a bathroom sink to be truly accessible, especially for someone who needs to sit down or uses a wheelchair, you absolutely need a clearance height of 70 to 75 centimeters straight underneath that counter. This comfortably fits a wheelchair user's knees, while the top height of the sink shouldn't go past 86 centimeters. It seems like a minor dimensional tweak, but it literally gives the user full, comfortable access to the faucet without wrecking their back or shoulders. Now, visibility during face care is about way more than just adding some bright bulbs. Standard flat mirrors? They're practically useless if you're seated. An ergonomic mirror needs its bottom edge sitting at a maximum of 90 centimeters from the floor. But here is the real game changer. Tilting the mirror forward 10 to 15 degrees downward. That specific angle guarantees that people who are shorter, seated, or using a wheelchair have a perfect, uninterrupted line of sight to see their own face.
And, of course, getting to the sink is just as crucial as using it. If an elderly person is using a wheelchair or a walker, they need a very specific turning radius to get around by themselves. If they are making a parallel approach to the sink or shower, they need an absolute minimum clear space of 90 by 122 centimeters, which really should extend up to 150 centimeters depending on the room's layout.
If you want to build a truly accessible space, one where someone can seamlessly turn around and maneuver between the sink and the shower without feeling trapped, the absolute gold standard is providing 150 centimeters of clear, unobstructed floor space. That's what ensures a smooth, safe transition from moving to grooming and finally to showering. Section 5. Vital safety equipment. Beyond just the spatial measurements, preserving lasting independence requires installing specific safety gear. There's a critical 3-step sequence here. First up, you have got to install slip-resistant floors that actually work whether they're bone-dry or soaking wet. Second, mount sturdy grab bars directly into the wall studs. And no, suction cups absolutely will not cut it. Third, circling back to our aging eye discussion, ensure you have that bright, glare-free lighting to prevent spatial confusion and eye strain. And let's talk about those grab bars for a second, because their placement isn't just arbitrary guesswork. They need to be installed precisely between 80 and 100 centimeters from the floor. That specific 90 to 100 centimeter sweet spot provides the exact center of gravity support an elderly person needs when they're transitioning from a walker or a wheelchair to a seated position. It is absolutely vital for their stability. A quick, crucial reminder on the flooring. Non-slip is essential, yes, but we also have to completely eliminate thresholds. A tiny threshold, we're talking just 1 or 2 centimeters, is enough to trap a walker's wheel, block a wheelchair entirely, or catch a shuffling foot. Every single room threshold must be removed or completely smoothed out. Just one tiny bump or a slippery wet patch can instantly cause a catastrophic fall, which completely negates every other safety measure we've just talked about.
Finally, Section 6, Freedom Through Design.
At the end of the day, why are we obsessing over sink heights and luxe lighting levels? Well, the whole shebang boils down to this. The ultimate goal is aging in place with dignity. When we ergonomically design a bathroom to match the biological realities of aging, we are actively preserving a person's independence. And by protecting that independence, the simple, everyday dignity of washing your own face safely, we directly fight back against the crushing emotional loneliness that so often comes with getting older. We aren't just designing bathrooms, we're designing for life satisfaction.
So I'll leave you with this thought as we wrap up today's explainer. Take a good look around your own living spaces today. Ask yourself, is your home biologically prepared to support your independence for the rest of your life? It's a pretty provocative question, right? But honestly, planning for it right now makes all the difference in the world. Thanks so much for joining me, and keep learning.